I'm Dr. Seetha Ramamurthy Pal, working as an obstetrician and fetal medicine specialist at the Institute of Fetal Medicine. Preterm labor, which means that labor that occurs before 37 weeks of gestation, that is early delivery, can have a lot of implications for the baby because the baby is small. It has to stay in the neonatal care for months, for maybe days and maybe months, and that has a long effect on its feeding, breathing, and sometimes even on the cognitive development of the baby, we say. Preterm labor is something that it can't be sort of prevented very well, but it can be predicted, and that is what we need to predict. And sometimes, if it is possible, also we can prevent, because preterm labor, India is one of the countries which has the highest rate of preterm births, and it's very sad because we all these babies have a lot of burden on the family, on social infrastructure, and that becomes a huge cost burdens for the entire system. Now, when we think patient has had a preterm birth in the previous pregnancy, then we need to see these patients early, because we can track the cervical length, which is the length of the mouth of the uterus, which is called the cervix, and track them and see whether they're actually there is a chance of going into preterm labor. And this is usually done by a transvaginal scan only somewhat in around 14-16 weeks, and even at the 20 weeks. And even for women who have not had a history of preterm birth in the previous pregnancy, we do routinely recommend measuring the cervical length at the second trimester, that is the anomaly scan, so that ladies who have a short cervix, we may follow them up and take some preventive measures like injections or even putting a stitch, because that can go a long way in preventing these preterm births that can affect these babies. So if you have had a previous history of preterm births, get in touch with your doctor so that we can scan you regularly, do an ultrasound of the cervical length, and take some measures accordingly to prevent this devastating situation, because it's only those families who've had preterm births can understand the implications of having a small baby and spending their months in the neonatal care unit. Thank you.